Hi everyone, this is Dr. Merhaut from Elite Sports and Spine Chiropractic. Joining us today for our Elite Education series, we're going to be talking about foot orthotics, specifically the ones that we have in the office here. We use the foot leveler system. These are custom made orthotics for your feet. With these, different things that we use them for. Someone comes in with plantar fasciitis, if they have knee pain, ankle pain, hip pain, even low back pain, we oftentimes look into seeing if orthotics are necessary for these types of patients. What the orthotics scanner will do, I'll show you a little bit. The orthotic scanner is right down here. What it does is it takes a laser scan of the bottom of your foot and it creates an image that will determine if the orthotics are necessary. It looks at things from weight balance from one side to the other, so it shows you a percentage of how much weight you're actually carrying on the right foot versus the left foot. It also shows you the pronation index, so that is how much the bottom of the arch caves in or the foot goes inward. That's called pronation. And then it also looks at some other things with the distribution of weight on the actual foot itself, so not necessarily right to left, but it shows you in a color what the weight distribution looks like. So I'm going to show you right over here. We have this image right here. The scan itself looks something like this. The one on this side is the optimal foot, so that's what the foot should look like if you have an optimal foot where there's not necessarily orthotics needed. The next one is mild pronation, then we have moderate pronation and severe pronation. So that pronation, like I talked about just a minute ago, was how much that arch actually drops. So you can see this foot, the amount of red, the whole foot is touching the ground, whereas in the optimal foot you have the arch that's not really touching the ground at all, so there's no pronation within that optimal foot. There's different severities of this. We see this all throughout the office. We see people on the spectrum all over the place. With that, that's going to determine if orthotics are necessary for you. Back over to the orthotic scanner, I'll show you a little bit of example of what the orthotics themselves actually look like. There's different kinds that you can get based on your activity levels, whether you're in your fetal day, whether you have worksheet shoes, athletic shoes, but this is an example of one that would be for someone that's a little bit more active and on their feet constantly, or running races, marathons, that kind of stuff. So you can see that the arch in this one is built up normally. If there's a certain amount of pronation within the foot, there's going to be a little bit of the arch built up on the inside of the foot. And then there's other little bumps in different spots based on the scan of your foot. So if there's a weight distribution on one side versus the other, there will be different markings in different places built up. You can see there's different layers of the orthotic that are placed within there throughout the heel, the midfoot, and also the forefoot. There's also ones, this one would even be one that could be used in high heels, for example. So there's orthotics that can be placed into the shoe. There's also, the company makes shoes themselves where the orthotic is built within the shoe. But those are different examples. So a wide range of things that we looked about in order if orthotics are necessary. So plantar fasciitis, foot pain, that is commonly associated with something going on with the foot, causing an abnormal stress within the foot, needing to do, that needs a little extra support. So the orthotics are used for that extra support. And we also incorporate some other things, whether it's some soft tissue releases, stretching or strengthening type exercises. So most of the orthotics in the office that we give people are more for that extra support that they can get throughout the whole day. Even things as simple as really drastic, but people that have headaches that could be directly correlated with something down the foot. And to explain that a little bit, with the foot, if you have the arch dropped a little bit, that will rotate the leg inward. That rotation of the leg inward causes a change and a shift within the pelvis, and then that pelvic shift also causes a change within the spine itself and can rotate the shoulders, even causing stress all the way up into the neck. So even problems down on the feet can relate anywhere up through the spine, through the knees, through the hips, all the way up even to the head. So that's more of a severe example, but it can happen, whereas problems in the feet can cause problems other places in the body. So if you think orthotics are something that you may benefit from, feel free to stop in. We can get you scanned. We'll get you a little bit of printout, explain what the printout means. You'll be able to see what the scan itself actually looks like on that printout, and then we can determine if those are necessary to order or not. This is the Elite Education Series, talking about custom fit orthotics. Hope you join us next week for our next education series.